Yeah, I do. I love my backpack in the car just because I was just trying to get my back and
And it,
all the attention.
yeah, I'll be back there. Nothing really changes other than it's more like
Still.
backpack work,
Right.
work like
Yeah. I was actually hitting a wax the other day. I was talking to my girl
take care of
about it.
myself.
Oh, but sometimes that's just
Yeah, it did. I was like,
somebody else taking over.
yeah, that is for sure, for sure.
Jamie was just taking over and lost her. I'm tired already. It took a big toll. It took a big toll on my business, you know. I can't. I'll help you out.
Hello, everyone. If you are a speaker today, if we could have you please come and stand behind the podium, we would really appreciate it. We're about to get started shortly.
Where's my pal? You're not a speaker. What?
No, she said that if you're a supporter, you can stand with us. And I said, okay, I'm a supporter.
Yes, you are.
I think he's donating blood. He said, me up here with the big dogs.
Good, good. Good. If, just trying to see what the next step is for the business.
Yeah.
Like, we've still been equipment only, and we haven't really been able to bring in other, like, staff.
Yeah, that's right.
Good morning.
Hello, thank y'all so much.
Jalen.
Hello. Sorry I'm late. I like to make fashionable entrance.
And fashionable weather it is.
Thank you. Hello, can you hear me? So we're going to go ahead and get started. I want to start off by saying thank you to everyone who's here today. The media, the press, I think there's such a powerful collaboration can be taking place. And when we have these needs and have these injustices to call upon, we rely on the media. And so I really appreciate y'all for being here. The organizations who are here in solidarity and asking for the same thing that I'm asking for, thank you so much for being here. As we all have collectively experienced, the ongoing COVID-19 pandemic has exacerbated many of our most pressing needs. This includes a dire need for blood donations across every community in the United States, and especially right here at home in San Antonio. Every drop counts, and as much as I would like to donate, I, a 26-year-old man, healthy and, as healthy as anyone can be right now, cannot donate, because of a homophobic and archaic regulation effectively forbidding me and other gay and bisexual men, trans women, non-binary, and queer people from donating blood. The FDA's revised recommendations for reducing the risk of human immunodeficiency virus transmission by blood and blood products states a man who has had sex with another man in the last 3 months must defer from donating for 90 days from the most recent sexual contact. All U.S. blood collection organizations must follow this federal requirement and are limited in who they can accept blood from because of this archaic regulation. And the history of this regulation goes back to the 1980s, when the HIV and AIDS epidemic further stigmatized the LGBTQIA+ community as the root of the spread when it was poorly misunderstood. This stigma has erroneously spread for decades, despite modern science effectively protecting all blood donations from any trace of HIV, syphilis, hepatitis, West Nile, or other blood-borne diseases. This past Wednesday, the president of the American Medical Association, Dr. Gerald E. Harmon, called for an end to this discriminatory practice. The American Red Cross, which supplies an estimated 40% of the nation's supply of blood and blood products, has stated its belief that blood donor eligibility should not be based on sexual orientation, and has committed to achieving that goal. And one effort that could speed that achievement is the ongoing Assessing Donor Variability and New Concepts in Eligibility, the ADVANCE study. And I have a call to action, and it's not just mine. I joined thousands of others, the American Red Cross, the AMA, and the Human Rights Campaign, to join the FDA to rescind any bans for MSM donors. I want to thank the South Texas Blood and Tissue Center, the LGBTQ Chamber of Commerce, our local organizations, Black Freedom Factory, the Pride Center, and the LGBTQ Health Equity Clinic for joining me here today and for joining me in this call to action that is federal in scope. Modern science is clear that there remain many effective and safe screeners of blood donations, and a crisis does not discriminate, and our response to end it should not discriminate either. We are not, as the LGBTQ community, we are not the only ones suffering. We want to give and we want to help, and there are people who are experiencing health complications and risks every single day who are being punished because of homophobia. It is not just us, it is everyone. And I want to introduce the next speaker, Camilla Denise Factory, Executive Director of Black Freedom Factory.
Good morning. My name is Camilla Factory, and I am the Executive Director of Black Freedom Factory, an organization dedicated to data-driven activism, communal advocacy, and alleviating racial inequity throughout the state of Texas. I also stand here today as a queer Black woman who understands that solidarity is a necessity in our community. I 100% back the efforts of Councilman Jalen's office to call out the discriminatory policy that gatekeep the rights of LGBTQIA+ citizens in the city of San Antonio and beyond. It is disgusting to think that the FDA might think that a policy like this can do anything but further marginalize an already vulnerable population. The LGBTQ community historically has faced xenophobia, homophobia, transphobia, and so many other types and forms of discrimination. We will not stand for this in the year 2022, when the Black Lives Matter movement is at the forefront of conversations and workplace policies. We will not stand for this as a queer community who have endured so much in the time that we have graced and innovated this earth. Trans, Black, queer, indigenous communities have innovated so many things about medicine. The people behind me are stakeholders in this community who also share the idea that it is time that we advocate for trans LGBTQIA+ communities. So Black Freedom Factory is happy to stand here today and proudly proclaim that its executive director is a queer Black woman who believes that our access to medicine is the same as any other. We believe that giving blood is a simple step in the future of innovating conversations of including queer folk in workplaces. Thank you.
Thank you so much, Camilla. The next speaker we have is Melissa Ochoa, president of former executive director of the LGBT Chamber of Commerce. Sorry if I floundered that.
That's okay.
Hello, my name is Melissa Ochoa, and I am the board president of the LGBTQ or LGBT Chamber of Commerce here in San Antonio. Thank you to the office of Councilman Jalen McKee-Rodriguez and Councilman for inviting me to be here beside you today. I'm honored to be here with you. According to the medical news today, article dated March 19th, 2021, the top, can people in LGBTQIA plus communities donate blood? It states, organizations such as the Red Cross understand that not all people identify as male or female and that there are many gender identities. They also acknowledge that sexual orientation should not determine blood donation eligibility. However, the FDA's revised guidelines require donors to define themselves as either male or female. People can self-identify or self-report their gender, allowing donors to register with the gender with which they most closely identify. There are no deferral criteria associated with being transgender, and eligibility is based on criteria relevant to the reported gender. So let me put it into perspective for you. The article goes on to say, for example, individuals who register as male will be ineligible to donate blood if they have had sex with another male within the past 3 months. Individuals who identify as female and have sex with a male may be eligible to donate blood if they meet all blood donation criteria. According to the FDA guidelines, people who are intersex will also need to self-report a binary gender to donate blood, but do not need to state that they are intersex. This also applies to people who identify as gender expansive, gender queer, gender fluid, agender, or non-binary. Individuals who are asexual can donate blood if they meet all other blood donation criteria. Let's look at what's happening in our world today. You can be walking around spreading the COVID-19 virus, any strain at this point, and yet no one is mandated to wear a mask. If it is a disease that can kill, why are there no mandates? Yet FDA guidelines go into men's private rooms to find out if they have had sex with other men to keep them from saving someone's life. Does that make sense? We must do something to change this guideline. It is not fair nor equal. In my line of work, when a loved one passes away, the family doesn't come to me and ask, did my loved one have term or whole life insurance? What they do ask is, am I going to be okay and our funeral expenses going to be paid? In a similar manner, an individual that is in a life or death situation and needs blood is not going to ask, did this blood come from a man that had sex with another man or from a man that had sex with a woman? All that individual wants to know is that they're going to live and have more time with their loved ones. If masks can save lives, then why are they not mandated to wear them? It's our choice. If blood can save lives, then why mandate who can give blood? It's our choice, and as anything else, we hope and pray that everyone uses their best judgment and are honest. Unfortunately, as in anything, we will not get 100% cooperation, but if the majority does, then that's many more lives being saved. The reason I chose to speak today is because one of my brothers, my baby brother, is a gay man, and he is married to his lifelong partner of almost 20 years. I didn't realize he was being discriminated against until I was invited today and asked to speak about this topic. I know that if any of our family or friends needed blood of any of us would be willing to take a transfusion with his blood, and I wouldn't want anyone to stop him or his husband from giving. Bottom line is, just the fact that straight people with multiple partners can give blood, but not monogamous gay men can't, is unacceptable. All my life, I have been a blood, platelets, and plasma donor. This will not be the last time you see me on this topic, Councilman. It affects one of my loved ones from giving, and why should who we are with behind closed doors matter when we want to save lives? Councilman, you can count on me, and you can count on the San Antonio LGBT Chamber of Commerce to be here and support you and beside you through this process. Thank you for the opportunity to speak today.
Thank you so much. And, you know, I have to say that there's a lot of people who do not know that this discriminatory practice is in effect. There's so many people who don't know that, you know, just yesterday on the dais, I shared my experience and my story when I was inviting people out to give blood, and I shared that I can't give blood myself and why. And there's so many people who are city staff who have access to resources and access to information who did not know that. So the everyday person, the average person, likely does not know this. And so if there was knowledge about this topic and if this information was shared far and wide, I think we would get so much closer to ending the practice. I also want to thank the Alamo Area Research Center for being here today. Having more and more organizations and businesses and nonprofits and leaders here, it does more and more to impact the change that we're seeking. At this time, I would like to introduce Robert Salcido of the Pride Center and the LGBTQ Commission.
Hello, my name is Robert Salcido, and I get the honor of serving as the Executive Director for Pride Center San Antonio. As San Antonio's LGBTQ+ Community Resource Center, we provide mental health services and a safe space to the most resilient of the estimated 95,000 LGBTQ folks here in the San Antonio and surrounding area. Federal regulations related to blood donation by LGBTQI+ individuals has been a topic of contention for almost 4 decades. In 2015, the FDA ended the discriminatory lifetime ban of blood donations for men who have sex with men and instead imposed a 12-month deferral. And in 2020, reduced that deferral to 3 months. While progress has been made, I'm here to say that it is not enough. Again, progress has been made, but it is not enough. The fact remains that gay and bisexual men still face discrimination and the inability to help the greater community. This is all during a global pandemic, in the wake of a national blood shortage, with less than 10% of eligible population actually donating blood each year. 10% of the actual population that is eligible to donate blood choose to donate, and that is it. How can we discriminate against a community that stands by one another each and every day and is willing to push forward and do that and come up for their community? But again, the discrimination is still in place. This is why federal regulations need outdated and out-of-touch restrictions that are currently in place. Regulations should follow modern medical science and move away from stigmatizing men who have sex with men and only further dividing our nation. On behalf of Pride Center San Antonio, we implore leaders at all levels within the U.S. government and the Food and Drug Administration to change these unfair and discriminatory practices once and for all. Let's follow science and not the stigma-ridden biases that continue to impact the LGBT community. It is important that we push forward with the information that our community needs, because as Councilman says, not everybody understands or even is aware that LGBTQ folks, particularly gay and bisexual men, are prohibited from donating freely when they are mostly able to do so without any causes. Again, let's follow science. Let's follow what needs to be done. Let's increase that 10% of our community that's donating and allow all LGBTQ folks in our community to do so. Thank you.
Thank you so much. And up next we have a dear friend of mine, Krista, with Greg Casar's campaign, who is also a good friend and councilman for City Council in Austin, running for Congress in my district.
Thank you, Councilman. I'm here today. My name is Krista Ortiz. I'm here today both as an individual, a fellow queer person, as well as the Deputy Political Director to Greg Casar in his campaign for Congress. I will be sharing a statement from Texas 35 congressional candidate and Austin City Council member Greg Casar. I'm honored to support Council member Jalen McKee-Rodriguez and his colleagues for this important event today. Our LGBTQIA community is stepping up to the plate to donate blood during a critical shortage of donations. And it is unacceptable that in 2022, the national policy is to deny them. I'm committed to undoing this discriminatory policy that needlessly excludes potential donors. Thank you. And thank you, Councilman, for creating this platform today.
Thank you so much for everyone who is here today. At this time, we'll have, everyone will be around, and if the media would like to ask questions, we'll be here. Thank you so much. Or please go give blood. Yes, thank you.
What do you think about what's happening? Discrimination?
This is absolutely we have a pledge to
No, but that was, I think,
discriminated
You think you can do something with this kind of event?
Yeah, you came in the blue. I think the more people who know about this discriminatory policy, the better. And you know, I think the city can take action and standing up and saying that this is a problem and solution to that.
Would you like to say something else?
I would like to say that it's very unfortunate that I, as a healthy 26-year-old man, am unable to donate blood. And you know, I would be so willing to if this policy was changed. Yes. Yeah. Thank you so much.
So that means that should be presented before the end of the month.
Great.
And you know, they got to put in the work. And we want to just keep everyone updated so that way y'all know when public comment is, so we can show up and show out as we often do.